Genetic variants can significantly influence an individual's response to cardiovascular drugs, including antiplatelet agents, statins, and beta blockers. Understanding these genetic factors is crucial for optimizing treatment outcomes and tailoring medication regimens. Here are some examples of genetic variants that affect response to commonly used cardiovascular drugs, antiplatelet agents. First up, let's look at clopidogrel. The CYP2C19 gene plays a vital role in the activation of clopidogrel, an antiplatelet agent commonly used after stent placement or in the management of acute coronary syndromes. Genetic variations in CYP2C19 can lead to reduced drug activation and decreased antiplatelet effect, resulting in an increased risk of adverse cardiovascular events. Testing for CYP2C19 variants helps identify patients who may require alternative antiplatelet therapy or adjusted dosing. Statins. Consider SLCO1B1. The SLCO1B1 gene encodes the organic anion transporting polypeptide 1B1, which is responsible for the hepatic uptake of statins such as simvastatin and pravastatin. Variations in SLCO1B1 have been associated with altered statin pharmacokinetics, leading to differences in drug efficacy and the risk of statin-induced myopathy. Genetic testing for SLCO1B1 variants can help guide statin selection and dosing adjustments. Beta blockers. Let's look at ADRB1 and ADRB2. The ADRB1 and ADRB2 genes encode beta-1 and beta-2 adrenergic receptors, respectively, which are targeted by beta blockers. Genetic variations in these genes can impact the response to beta blockers in conditions such as hypertension, heart failure, and arrhythmias. For example, certain ADRB1 gene variants have been associated with reduced response to beta blockers in heart failure patients. Genetic testing for ADRB1 and ADRB2 variants can assist in selecting the most appropriate beta blocker or alternative treatment options. It is important to note that these are just a few examples, and there are numerous other genetic variants that can influence the response to cardiovascular drugs. Pharmacogenomic testing can help identify these variants and guide treatment decisions, allowing for personalized medication regimens that optimize efficacy and minimize adverse effects. Integrating pharmacogenomics into cardiovascular care has the potential to improve treatment outcomes and enhance patient safety.